Okay.
Good morning. My name is Dr. Melody Keith here at Lakeway Aquatic Physical Therapy, and we're in beautiful Lakeway, Texas. Today, what we are talking about is sciatic nerve pain. And sciatic nerve pain is very, very common. It's estimated about 40% of Americans at one point in their life will experience sciatic nerve pain. So if you have or have had sciatic nerve pain, what we're going to do today is going to give you a little bit of background on it, and then we're going to just give you a few exercises, some things that you can do to possibly help it. I'm a big advocate on physical therapy, so try physical therapy if you haven't tried physical therapy to help your sciatic nerve pain. Please do. Also, remember that sciatic nerve pain, I think a lot of people gather it into one, oh, I've got sciatic nerve pain. And you might have pain down here on the side of your leg. That's not sciatic nerve pain. That is another aspect of back pain. It could be back, could be hip, and that's what we do in physical therapy. We have special tests that tell us and direct us what type of exercises are going to be best for you and what's happening. If you have sciatic nerve pain, you're going to feel it in the back. The sciatic nerve runs right down the middle of the leg. And you can have it from into just the buttock area. It can go sometimes down into the back of the leg. Remember, if it's in the side of your leg, if it's in the front of your leg, if it comes around to the front, that's not sciatic nerve. That's where you need to get an evaluation from a physical therapist that knows these things, that understands the nerves and how they work, the body and the biomechanics of the body to help you. So what we're going to do today is, for those of you that have sciatic nerve pain, how do we relieve it? Yes, there's a lot of different things out there that say, oh, this helps, this helps, this helps. Well, after 20 years, over 20 years in this business, I know I don't look that old, but after 20 years in this business, I've noticed clinically some things that really help people with sciatic nerve pain. And the first one, we're going to go over to Miss Amy. And this is a prone glute activation. And what we've done is she is on her stomach. We've got her next to the wall. Now, if you can't get on the floor, that's fine. If for some reason that you can't lie flat, you could get some extra pillows and put them up underneath you, right? So just get comfortable on your stomach. That's the first thing, okay? Once you can get comfortable on your stomach, what you're going to do is what we call a gluteal activation. We're trying to activate gluteus maximus to take the stress off the sciatic nerve. So by bending the knees, we're going to take the hamstrings and make them passively insufficient so that the hamstrings are not going to play a role in this. And then you're just going to activate gluteus maximus, and you're pushing the front of your pelvis into your groin, everything into the pillow, holding it for 10 seconds. Again, to neuromuscularly change the tissue irritability into the posterior hip capsule, it requires some time. So don't rush this. Enjoy the ride, right? So, and I would recommend about 10 or 15 of these. Try to get comfortable on your stomach. Try to get comfortable with your knees against the wall and pushing into a pillow. The pillow makes it really nice to where that you have proprioception of where you're pushing. All right? Next one is just a hip internal external rotation. And you're just going to try to keep your knees together, try to activate the glutes, and take your legs out, hold them, about, how long? 10 seconds. Beautiful. And back in. And activate the glutes. 10 seconds. So notice we're going very slowly. We're trying to just get the hip and the pelvis, the posterior capsule, to move a little bit to take the stress off of the sacroiliac joint. So if the sacroiliac joint moves better, guess what releases? The tension into the sciatic nerve, right? And so again, I would say about 8 or 10 of these, okay? And you can see Amy's got really good range of motion. I've noticed over clinically that people who have a lot of sciatic nerve don't have that good of a range of motion, both in and out. So that's something that you can work on, right? The next one, Amy, if you just get up on your hands and knees, we're just going to go into what we call ragdoll over the ball. So just hanging. So again, trying to just calm the dural system down, try to help the back out, try to stretch out the lower back a little bit, right? Because the origin of the sciatic nerve is from the lumbar spine. So this is what we call a dural stretch. It stretches the covering of the spine. It's very gentle. If you don't have a ball, just use the back of your couch cushions and relax. Breathe. Breathing's very important to this. Just inhale and exhale. Just take some deep breaths in. Try to let your head down. You can see Amy's just relaxing, hanging out, letting it just relax a little bit. Just take the stress off the back. Right? Also, I'm a big advocate of ice to help. If you've been using heat, try ice and see if you can stay off the heat and see if the ice will help. If you need any more information, we here at Lakeway Aquatic Physical Therapy would love to have you come in. Again, we have a lot of tools in our toolbox, and if the land just doesn't work for you, we can put you in the water. Okay? Please remember to like us on Facebook, like us on YouTube. We'd love to have you subscribe to us. If you have any questions, you can ask them on Facebook, or you can just call us here at the office. We'd be glad to answer any questions that you have on insurance or getting scheduled and what it takes to get in to come and see us. All right? Have a great day. Bye.